Welcome to the Deep Dive, your shortcut to being well-informed. We sift through the latest reports, research, and our own notes to bring you the essential insights. Today, we're diving into something really transformative happening in Indian healthcare. It's the remarkable rise of single specialty hospitals. We've gone deep into the latest report, single specialties carving their own path in Indian healthcare, and our mission to pull out the key nuggets for you so you're up to speed on this booming sector.
It really is booming, and what's fascinating truly is just how quickly this segment is growing. Just to give you some perspective, back in 2019, single specialty hospitals were roughly 20% of the total Indian private healthcare market revenue. That was about, let's see, INR 52,000 crores, or US $6.2 billion.
Okay, 20% back then.
Right. Now, fast forward just 5 years to 2024. That share, it's jumped significantly. We're talking 30% now.
Wow, a 10% jump in share.
Exactly. Accounting for INR 126,000 crores, or US $15 billion. That's a compound annual growth rate of 19%.
19% CAGR. That's strong.
Very strong.
Mm.
And looking ahead, by 2028, it's projected to hit 40% of the entire private market.
40%.
Yes, potentially reaching INR 264,000 crores. That's US $31 billion, with a projected CAGR of 20%. The acceleration is really something.
That's a dramatic shift. So, okay, let's unpack this. What's really driving this significant breaking away phenomenon? Why are these specialized hospitals gaining so much ground compared to the traditional multi-specialty setups?
Well, it really boils down to several core advantages. They build up a powerful competitive edge. Single specialty hospitals can really focus on targeted innovation. They get very specific equipment just for their niche.
Right, tailored tech.
Exactly. And that focus builds higher brand equity, too. Patients seeking that specific treatment know where to go. Operationally, their unit economics are just, well, optimized, often lower capital expenditure, lower operating expenses.
CapEx and OpEx, yeah.
Right. They benefit from high volume procurement, buying lots of the same thing, and achieve significant economies of scale. This whole streamlined approach leads to high scalability. The operations are repeatable, capacity is customizable.
Sort of like a well-oiled machine for one specific task.
Precisely.
Yeah.
And the doctors. They become hyper-specialized. They dedicate their clinical expertise without, as many administrative distractions. Plus, there are other benefits. Lower risk of cross-infection because you have a more homogeneous patient group.
Ah, interesting point.
Improved proximity to patients often, maybe smaller clinics closer to communities, and a very customized patient experience, usually with lower turnaround times.
So what you're describing isn't just like a list of pros. It's almost a virtuous cycle, isn't it? This focus leads to efficiency, attracts the best talent, brings in specific patients, which fuels better outcomes and financials. It seems like a fundamentally different value proposition than a big hospital trying to do everything. But that raises a question. Are all medical specialties equally suited to, break out like this?
No, not at all. Good question. Certain specialties are definitely more suitable for this kind of focused model. They tend to have low interdisciplinary dependencies, meaning they don't rely heavily on, say, 5 other departments to do their core work.
Okay, less complex coordination needed.
Right. They also typically involve high specificity of indications. Patients come knowing they need that specific thing, like IVF or eye surgery. High specificity of infrastructure and equipment needs also plays a role. It makes sense to centralize specialized, expensive gear. And often, lower capital expenditure intensity helps too. It's easier to set up dedicated facilities if the initial cost isn't astronomical for that specialty alone.
Okay, so focused needs, focused infrastructure. Got it.
Yeah.
Now, you mentioned financials earlier. This isn't just a clinical story, is it? It's a major financial one, too. Growth like this must attract investors. How has this trend impacted investment? And what's the outlook for capital flowing into these single specialty players?
Oh, absolutely. The investment community has definitely taken notice. There's a huge and growing total addressable market, the TAM, across these specialties. It's fueled by India's population, demographics, aging population in some cases, and definitely increasing affordability for healthcare.
So the potential patient pool is massive and growing.
Exactly. And we're seeing leaders emerge in single specialty chains. They're capturing like 20% or more of the organized market in key segments. Their unit economics are very attractive to investors. We're often seeing 20% plus EBITDA margins at the center level.
EBITDA, right? Earnings before interest, taxes, depreciation, amortization.
Yeah.
A good measure of core profit.
Precisely. And some specialties like IVF, which we'll probably touch on, can see over 100% return on capital employed, ROCE, at mature centers.
Wow, 100% ROCE. That's
Yeah.
sufficient use of capital.
Extremely. ROCE shows how well they're using their money to make money. It's a highly scalable business model, too. It's driven by building strong brands and also by M&A roll-up strategies, buying up smaller practices.
Consolidation.
Yes, and the numbers show it. Single specialty hospitals have attracted roughly 36% of total hospital investments since 2015, and that share, it's been increasing recently.
So more and more PE money is flowing specifically here.
That's the trend, and looking ahead. The market capitalization of the listed single specialty hospitals. Well, it's estimated it could reach INR 150,000 crores. That's US $18 billion by FY30.
Huge potential.
Driven by new IPOs, new public listings, it looks set to replicate the kind of growth we saw in multi-specialty hospitals over the last decade or so.
That paints a very clear picture of why this is happening and why the money is following. But, to really grasp it, we need to see how it works on the ground in specific fields. So let's zoom in. Let's look at some of the established specialties that are really leading this charge. Maybe start with IVF, in vitro fertilization.
Good place to start. India presents a really unique market opportunity for IVF. First, the demographics. India has the most women globally in the key 25 to 44 age group.
The main reproductive window.
Exactly. And infertility prevalence seems surprisingly high here. Some studies show 18–19% in India. That's higher than the global average of maybe 12–15%. It seems driven by lifestyle factors, but also clinical conditions like PCOS, polycystic ovary syndrome, and even endometrial TB, tuberculosis affecting the uterus lining.
So high need. But what about access?
Well, that's the paradox. Despite this high need, India actually has one of the lowest IVF penetration rates globally. Lots of people who could benefit aren't accessing it yet. But on the flip side, India also offers the cheapest IVF treatment costs in the world.
Lowest penetration, but cheapest cost. Interesting mix.
Very. It makes India very attractive for medical tourism in this space. The market itself is projected to reach somewhere between INR 12,000 to 14,000 crores by 2028.
Given how sensitive IVF is, I'm curious about the technology side. What new advancements are making a difference here? Improving outcomes? Maybe safety.
Technology is playing a massive role, absolutely crucial. We're seeing things like RFID-based electronic witnessing systems.
RFID, like tags.
Yeah, to meticulously track eggs, sperm, embryos. It significantly reduces the risk of mix-ups, which is paramount in IVF. There's also robotics-assisted sperm injection, ICSI, for much greater precision during fertilization, and techniques like laser-assisted hatching, which can help the embryo implant.
Improving the chances of success.
Right. And vitrification, that's a fast-freezing method for cryopreservation of eggs and embryos. It's much better than older slow-freezing methods, prevents damaging ice crystals. Huge improvement. And AI, artificial intelligence and machine learning are increasingly used.
How so in IVF?
For optimizing embryo selection, analyzing sperm quality, even assessing hormone levels or lifestyle data to personalize treatment plans. It's getting quite sophisticated. We're also seeing innovative therapies emerge like ovarian rejuvenation, stem cell therapy, though these are still quite new, sort of experimental stages.
Sounds like a lot of innovation. What about regulation? Has that kept pace?
That's a really important point. The RT Act, Assisted Reproductive Technology Act of 2021, was a crucial development. This law is standardizing practices across the board. It's curbing unethical behavior, which unfortunately existed. It requires clinics to register, get explicit patient consent, adhere to strict donor age limits, supply limits.
So bringing structure to a previously fragmented, sometimes unregulated space.
Exactly. It's really pushing the unorganized sector towards becoming organized, ethical, and standardized. Vital for patient trust and quality. And this ties back to the single specialty model. These chains typically offer superior success rates, maybe 55–60%. They operate on a standardized, replicable model.
Good for quality control and expansion.
Definitely. And it leads to impressive profitability. We mentioned over 30% EBITDA, maybe 100% plus ROCE for mature centers, often generating revenues around INR 12 crores per year per center. This efficient model supports rapid expansion, including into India's Tier 2 cities, making quality IVF more accessible across the country.
Okay, fascinating look at IVF. Let's shift gears now. How about Eyecare? That's something, many of us deal with eventually.
Indeed. And India carries a huge burden here. The highest number of visual impairment cases globally are found in India. But here's the really striking part. 80% of this visual impairment is preventable or curable. 80%.
That's staggering. So much avoidable blindness or vision loss.
It is. And untreated cataracts remain the leading cause of blindness in India, accounting for something like 66% of cases. Key drivers. Well, a growing geriatric population, obviously. India's tropical climate seems to increase cataract prevalence. Also, the rising number of diabetic patients, diabetic retinopathy, is a major issue. And of course, increased screen time leading to more myopia, especially in adolescents.
All contributing factors, so the market potential must be significant.
Huge. The eye care market is expected to reach INR 50,000 to 60,000 crores by 2028.
Now, I'm curious about how this market itself has evolved. Has it been a smooth growth curve, or were there bumps, especially given that high prevalence you mentioned?
It's been quite dynamic, actually, not a straight lineup. The Indian private eye care market hit a bit of a stagnation period after the fall of Vasan. They were a big player back in 2015.
Right, I remember that name.
Their collapse caused some ripples, but then new leaders emerged. And post-COVID, the sector saw exponential growth, really fueled by significant new funding coming in. We can look at examples like AirEye in China. Their growth story is often cited as a potential roadmap for India's ophthalmic industry.
A model for scaling up. And technologically, what's happening in eye care?
Lots of advancements. LASIK surgery for correcting vision has evolved. We now have wavefront-guided LASIK, Contura Vision LASIK. These are more personalized. There are newer procedures, too, like Zepto cataract surgery is a very precise automated capsulotomy device. And Smile small incision lenticule extraction, it's a minimally invasive alternative to LASIK for some patients.
So more options, more precision. How do the single specialty chains leverage this?
They have a big edge here. They provide a standardized, often premium patient experience. Very consistent. Many use a hub-and-spoke model. Smaller clinics for initial consultations and follow-ups, the spokes feeding into larger surgical centers, the hubs.
Efficient for reach and managing surgical volume.
Exactly. It boosts operational efficiency and leads to attractive unit economics. For instance, a hub center might generate, say, INR 1.5 to 2 crores in revenue per month, with EBITDA margins around 30% and ROCE over 50%. Very healthy financials.
Okay, strong model there too. Next up, let's explore mother and child care. This feels like a foundational area, but one that's clearly seeing this specialization trend.
Absolutely. And India's position here is, again, quite unique. Highest number of women in reproductive age globally, records the highest number of births globally. But despite these huge numbers, India still lags behind developed countries in institutional deliveries, births happening in a healthcare facility. And sadly, the country still faces high maternal mortality rates, MMR, and neonatal mortality rates, NMR. There's a clear need for better specialized care.
So a huge volume, but also significant quality and access gaps to fill.
Precisely. This creates a massive market opportunity. The maternity care market alone is projected to hit over INR 41,000 crores. And the pediatric market, over INR 170,000 crores by 2028. Growth here is driven by increasing complexities in pregnancy, rising demand for, experiential value-added services, not just clinical delivery, and of course, rising affordability helps people choose specialized centers.
And are these centers just focused on birth itself or broader?
That's an interesting aspect. Many players started focused just on maternity, on childbirth, but they've successfully expanded into closely related areas adjacencies, like pediatrics, fertility treatments, gynecology. They offer integrated care, often under one specialized roof, covering the whole journey.
A continuum of care model.
Exactly. These single specialty mother and child chains offer comprehensive services. They invest in the latest advanced equipment, have specialized dedicated service lines. They operate on that scalable, replicable model we've discussed. Average revenue per hospital might be INR 30 plus crores per year, with EBITDA around 20% plus, and ROCE maybe 20-25%. So they're very competitive against both the big multi-specialty hospitals and smaller local nursing homes.
Sounds strong, but any caveats?
One thing to note is that the specialty is sometimes seen as a bit more localized. People often prefer care closer to home for pregnancy and childcare, so that might impact the pace of, say, national consolidation compared to something like Eyecare, which can be more destination-based for surgery.
Right, geography matters more, perhaps. Okay, let's pivot again. Dialysis. With lifestyle diseases on the rise, this must be a critical growth area.
Critical is the right word. India faces a really significant kidney health burden. We rank second globally in the prevalence of chronic and acute kidney disease, CKD and AKI. And projections suggest India might actually overtake China in the next 5 years. That's a staggering thought.
Overtake China in kidney disease prevalence.
Wow.
Yes.
And renal failure currently accounts for over 3% of total deaths in India. It's a major health issue, the main drivers. A growing geriatric population, yes, but also the huge rise in lifestyle diseases. Diabetes and hypertension together account for maybe 40 to 60% of all CKD cases.
The connection is direct and devastating.
It is. The dialysis services market, just the services part, is expected to reach INR 11,000 crores by 2028.
Given that scale and the chronic nature of kidney disease requiring ongoing treatment, what's happening technologically? How are we improving treatment and access for so many people?
Well, globally, there are significant advancements. We're seeing R&D in nanotechnology for better purification methods in dialysis. And there's a lot of work on portable, even wearable dialysis machines. Things like Fresenius's Next Stage 1 or the experimental wearable artificial kidney. The goal is greater patient mobility and freedom.
Taking dialysis out of the clinic, potentially.
That's the long-term vision. Also, hemodiafiltration is gaining traction. It combines hemodialysis and hemofiltration for more effective waste removal. However, in India specifically, home dialysis, both hemodialysis and peritoneal dialysis, PD, is still quite nascent. It hasn't taken off widely yet.
Why is that, if it offers more convenience?
Several factors. Cost can still be a barrier for home setups. There's a higher risk of infection, particularly with PD, if not managed perfectly. And there's a scarcity of trained staff to support home patients. This is despite the government including home PD in the National Dialysis Program, the PMNDP. Adoption remains low.
So clinic-based dialysis is still dominant. How do the chains operate here?
Single specialty dialysis chains focus on providing standardized, high-quality care, but crucially at affordable prices. They operate across different formats in clinic centers, on-call services for hospitals, and supporting the few doing home HDPD. A key advantage here is relatively low capex intensity. Setting up the equipment for a dialysis center costs maybe INR 40-60 lakhs.
Much lower than, say, an oncology center.
Much lower. This leads to quick break-even periods, maybe just 4 to 6 months for a new center. The economics are attractive. EBITDA often 25% plus, ROCE 30% plus. And the government plays a huge role here through public-private partnerships, PPPs. These PPP models drive significant volume growth and help expand access, especially outside major cities.
PPPs are key for scale in dialysis, though.
Yeah.
All right, final established specialty for a deep dive, oncology. Cancer care. This is where advanced specialized expertise seems absolutely vital.
Absolutely vital. And India faces a profound cancer challenge. We're second only to China in the actual number of cancer cases. But it's a dual problem here. High burden, yes, but also late-stage detection for many major cancer types.
Meaning diagnosis happens when the cancer is already advanced.
Too often, yes. And that, unfortunately, leads to higher mortality rates compared to peer countries where early detection is more common. Plus, there's a significant demand-supply gap for oncologists. Not enough specialists for the number of patients.
A challenging picture. But is the market growing despite these issues?
Yes, significantly. The oncology market is estimated to grow about 1.7 times, projected to reach INR 42,000 to 44,000 crores by 2028. Driven partly by increasing life expectancy, but also sadly by the rising incidence of lifestyle-related factors, large tobacco and alcohol use, pollution, obesity.
So more people needing care. What about the treatments? Oncology tech moves fast.
Incredibly fast. There are huge R&D investments leading to amazing innovations. Think about CAR T-cell therapy.
Right, engineering a patient's own immune cells.
Exactly. Powerful stuff. Though currently it's very expensive, maybe INR 20-25 lakhs per procedure, putting it out of reach for most Indians right now. Or proton therapy, that's a very precise form of radiation, minimizes damage to healthy tissue. Apollo actually launched the first center in South Asia and the Middle East.
Cutting-edge treatments becoming available.
Yes. Plus, things like gamma knife, cyberknife, highly focused radiation treatments, and rapid progress in molecular imaging and using AI for earlier, more accurate cancer detection. In this landscape, the comprehensive cancer care chains, the CCCs, are really best positioned.
Why them specifically?
They offer that premium quality, the advanced infrastructure needed for these treatments, the highly specialized doctors, and crucially, multidisciplinary tumor boards.
Where different specialists collaborate on a patient's plan.
Exactly. It's essential for complex cancer care. They operate on a standard, replicable model, like the other specialties. Mature centers show good margins, maybe 18-20% EBITDA, over 35% ROCE. This is despite higher capex, setting up an oncology center costs more, maybe INR 25-40 crores, and the longer break-in times, perhaps 24-36 months. But the need is so vast, there are significant opportunities for expansion, especially into Tier 2 plus towns, either by acquiring existing facilities or building new ones.
A complex but crucial area for specialized growth. Okay, that covers the established leaders really well. But what about the future? As we look ahead, there must be other specialties just starting to show this kind of potential. Our report touches on a few, but it highlights dental care as maybe the next big wave.
It certainly has huge potential. Globally, the dental care market is enormous, expected to be over, USD 850 billion by 2028. And oral diseases, they're actually the most prevalent non-communicable diseases, NCDs, globally, with India leading in cases within Southeast Asia.
Highest prevalence globally, and India leads in the region. That's
Yeah,
surprising.
it is a massive public health issue. But here's the gap. Despite this incredibly high incidence of dental problems, India significantly lags in the availability of dentists. We have the lowest number of dentists per 10,000 population globally. Lowest.
So massive need, very low supply of providers.
Exactly. Creates a huge demand-supply gap, and therefore significant headroom for growth. Right now, the market is very fragmented, dominated by small individual clinics. This creates a clear opportunity for single specialty dental chains.
To bring standardization, scale, technology.
Precisely. To standardize care, leverage technology, think digital imaging, AI diagnostics, maybe even teledentistry, and build trusted brands. Comprehensive dental care covers a lot, right? Orthodontia braces, endodontia root canals, oral surgery, periodontal gum care, pedodontia kids dentistry, implantology, general dentistry, prosthodontia crowns, bridges.
Quite a range.
Yes, but each of these areas can be systematized, delivered efficiently within a specialized chain model. It really feels like the next frontier for this single specialty boom in India.
What a fantastic deep dive we've had today. It's clear that single specialty healthcare isn't just, some passing trend. It's a powerful force really reshaping India's medical landscape. We've seen everything from that deep specialization in patient care leading to better outcomes, all the way to attractive unit economics drawing significant investor interest. It truly is a story of focused growth and hopefully improved patient experience.
Absolutely. And if you connect it to the bigger picture, it really underscores how innovation, when combined with a very tailored, focused, efficient approach, can unlock immense potential. It's a pathway to making quality healthcare more accessible, more efficient, even when facing really significant population health challenges like India does.
So for you, our learner, listening today, perhaps this raises an interesting question to think about. How might the lessons we've seen from India's single specialty healthcare boom apply to other service industries? Where else could that kind of intense specialization lead to greater efficiency, better outcomes, maybe new investment opportunities, something to mull over?